Well, the month of May is Mental Health Awareness Month. To talk about mental health awareness in regards to disaster is Disaster Mental Health Supervisor Bob Jolley. Bob, thank you for joining us today.
You bet.
Bob, some people may have heard about the term disaster mental health. Can you talk a little bit about what that actually means?
Sure, be glad to. In response to disasters, whether a home fire or tornado, hurricane, floods, wildfires, Red Cross provides food and shelter for people who are in need. And in addition to that, provide individual disaster care. That includes disaster mental health, health services, and spiritual care services. What it means really is we provide support for people who have emotional and or psychological needs as a result of the disasters that they've experienced.
Now, we've seen plenty of disasters across the country over the last year. The Red Cross has had, there have been $28 billion disasters in the United States, ranging from wildfires to hurricanes to floods like we've seen here in northern New England. Can you talk about what role does the Red Cross play in a disaster mental health? How does that all work in the wake of a disaster?
Well, there depends to some extent on whether it's a local situation or something nationally. By and large, we would respond to local fires, for example, home or apartment fires, with a cadre of intake people that would meet with the folks who'd experienced the disaster and ask them about their needs, including whether or not they need health care services or mental health services. That could result in a referral if there's a request from the client or if one of the intake workers senses that there's a need that needs to be met. In a national situation, mental health volunteers would be sent along with a large group of others to provide sheltering and, in our case, provide support for people's emotional needs, emotional and psychosocial needs. And again, we're licensed professionals who have had training in psychology or social work or counseling, and bring that expertise to the work that we do with clients.
If someone has experienced a home fire or hasn't experienced a large scale disaster, how can someone access these services from the Red Cross?
Essentially by calling 1-800-RED-CROSS, 1-800-733-2767. We'll get them to the national 24/7 line, and then they would be routed back through to the local chapter responders. If a person is interested specifically in mental health care, generally that would be a part of the discussion when they were doing an intake post disaster. They may request it. It may be a recommendation of the person doing the intake, but that's essentially the way that people could get to us.